Hello everyone, my name is Hian, and today I'm moving to typical patient presentation. About the etiology, the underlying cause of the disease, diabetes mellitus type 2 is often linked to the development of insulin resistance. This is a complex condition in which the disease develops insensitivity to insulin. Several genetic and lifestyle factors also contribute to the development of insulin resistance. In this slide, we can see the illustration of insulin resistance. The insulin resistance happens for no reason, but we know that the key players in your systemic glucose mechanism, they don't function well. They include the liver, the fat tissues, and muscles. Usually, insulin plays a role to help glucose move into the cells. But in this case, the cell becomes resistant to insulin. So the glucose, instead of going into the cells, they are stay in the blood, which leads to the hyperglycemia.
Moving to the disease background. Diabetes.
Here is some risk factor of the disease. The first one is age. The older the age, the higher the risk of having the disease. The second one is genetic susceptibility. Next is obesity. People who have sedentary lifestyle with minimal physical activity are also at the high risk of having the disease. And the last one is metabolic syndrome. This is a constellation of disorders, including central obesity, dyslipidemia, prehypertension, and elevated fasting blood glucose level, that together for a high risk of developing type 2 diabetes and associated cardiovascular complications. The metabolic syndrome often develops during childhood and is prevalent among overweight children and adolescents. Metabolic syndromes is characterized by many of the same genetic and environmental risks as type 2 diabetes, and individuals should be screened on regular basis.
Moving to the pathophysiology of the disease. In diabetes mellitus type 2, the pancreas is unable to produce enough insulin to manage blood glucose levels. The cells become resistant to insulin for unknown reasons. The insulin resistance leads to the increased glucose production in the liver and the decreased glucose uptake both in the muscle and liver, and also the adipose tissues. In diabetes mellitus type 2, the antibodies are not present. In contrast to diabetes mellitus type 1, insulin secretion is typically increased at the time of diagnosis, but progressively declines after that. Insulin resistance defines the disease. The insulin resistance is known as the suboptimal response of insulin-sensitive tissues to insulin. In the liver, we see the increase in hepatic gluconeogenesis. In adipose tissues, we see the decrease in the glucose uptake, increase in the lipolysis. In muscles, we see the decrease in glucose uptake too, and also the increase in the lipid accumulation. Insulin resistance can be more dangerous if it is associated with obesity. The elevated levels of free fatty acids interfere with the intracellular insulin signaling, decrease the tissue response to insulin, and alter incretin actions, and promote inflammation. The inflammatory cytokines induce insulin resistance and are toxic to beta cells. The hyperinsulinemia and the decreased insulin receptor density are correlated with obesity. So these are the symptoms that the patient with diabetes mellitus type 2 often have. The first one is blurry vision. Second one is the increased thirst or the need to urinate, the recurring skin, gum, or bladder infections, the paresthesias, the numbness or the tingling, especially in the feet, and slow healing cuts or bruises.
The first diagnosis test is A1C. A1C is used to check for the glycosylated hemoglobin. In the test, we are checking to see if the glucose has reached a high enough concentration to where it starts to really glycosate up hemoglobin molecules in the blood. It's really good test because it can provide about the average blood glucose level for the past few months. So this is usually the first test that doctors gonna run if they suspect diabetes. You just need to get one blood draw to see the result. And you don't have to get stuck multiple times over and over again. It's considered a positive diagnosis if on two separate tests that these are at least 6.5% or higher. Usually though, the normal value is 5.7% or lower. So anything between 5.7% to 6.4% is diagnosed as pre-diabetes. The second one is fasting blood sugar test. A blood sample is taken after overnight fast. And again, the positive diagnosis is given when they are above 126 mg per deciliter. If they are less than 100 mg per deciliter, results in normal. Any number between 100 to 125 mg per deciliter is diagnosed as the pre-diabetes. Another test is random blood sugar test. This test is regardless of when the last testing, the random blood sugar level of 200 mg per deciliter or higher indicates the diabetes.
Screening is also another way to get diagnosed for the type 2 diabetes. The U.S. Preventive Services Task Force recommends screening for adults who age from 35 to 70 years having the overweight problem. They should have the screening every year to get the fasting plasma glucose test or the hemoglobin A1C level test so that they can diagnose if they have the diabetes type 2 as soon as possible.
So the treatment for the disease tend to be diabetes type 2 can become more dangerous.
Here are the references that I used for my presentation.